which is hard because these guys are preserved, and so you're going to have to really cut through a lot of muscle on the sides of the mouth to open this up. They're very stiff, and so I'm going to do a messy job that you guys can do it more carefully. I just want to show you guys the basics. And our scalpels are not very sharp again. I think scissors are going to be better than scalpels, although it kind of makes a gross sound. Okay, kind of. Okay, so now you can kind of see the tongue is kind of misshapen in this frog, but you can see that it's attached in the front of the mouth and not the back. You can also see this tiny opening here, which I'm going to show you with the probe, which is the glottis. Alright, that's going to lead right into the trachea, and when you open it up, you should be able to follow that down into the lungs. You guys can all see that? And behind that, you'll find the opening to the esophagus. So again, once you open your frog, it's kind of nice to take your probe and see if you can figure out where it goes into the stomach. Right? You should be able to trace both trachea and esophagus that way. Internal nares should be up here. They're kind of covered up with some kind of gunk that you might want to wash out of the mouth of your frog. Right? So those are the internal nares in the top of the palate. You guys see that? And you'll see these little prongs here, those are the vomerine teeth. They're not really like teeth, they're just little sharp points that probably just help to prong, hold the prey inside the mouth once it's been captured with the tongue. And then eustachian tubes here on the side, right? Eustachian tubes connecting ear to buccal cavity, right? Same thing that you guys try to clear the pressure when you're on a plane or something like that. And then this is opening to the vocal sac, which looks very small in this, so I'm thinking maybe this is a female. In a male, you'll probably see a really large opening right here below the eustachian tube, which will be the opening to the vocal sac, but I don't see it in this one. Okay, so that's kind of the buccal cavity. And then what you guys are going to do with most of these vertebrates is kind of make a medial incision here on the ventral surface, and then lateral incisions around the limbs so that you can kind of open the two flaps to reveal the abdominal cavity and the thoracic cavity. And if you want to, you can go further into looking at muscles and other things, but the main thing we're going to look at is the viscera, the internal organs that you're going to see inside of the body cavity. So I would say just start with a scalpel, and then if it doesn't work well, use a forceps and scissors. You want to not make too deep of a cut, but these scalpels really barely cut at all. So there we go. Then I think it's definitely easier to use scissors. The sharp point of the scissors works better. And this is definitely a female, because the first thing you see is a giant mass of eggs. See that?
Oh my god.
Yeah, this is what's really nice about these bullfrogs. They're so big that you can really see everything pretty dramatically. Can't see?
Oh, good.
You guys all saw that? Okay.
It's disgusting.
So make sure that if you guys have a female, that you also get a look at somebody else's that's a male, and vice versa. Yeah. Now once we get into the vertebrates, a lot of the anatomy is probably going to be really familiar to you guys, so it's not as challenging to identify things. However, in a frog, there are a couple of different things that are different from other vertebrates. I'll try to open this a little there's bone here that's kind of difficult to cut through. Okay, so I'll show you really quickly the basics. Most vertebrates, when the first thing you see when you open them up is liver. And liver is usually pretty recognizable tissue. It's very solid. It usually has different lobes to it. You'll get to recognize the texture of it and the way it kind of looks. In the frog and in some of the reptiles, you have these unusual things that you see right here. And you're going to see them a lot in these bullfrogs because they're so big. This stuff is called fat bodies. Right? It kind of makes sense in an amphibian if you think about the way that they breathe through their skin, right? So it would not be a good idea for an amphibian to insulate itself the way we do with fat deposits under the skin, because that would make it difficult to do gas exchange. So they have their fat organized into these little finger-like projections. And you'll see it in some of the reptiles too, even though the reptiles generally don't breathe through their skin. So that's probably just a legacy of their evolutionary history. So we're going to have to remove these eggs from this female. But before we do, the eggs are attached to this enormous thing, which is basically oviduct, right? One on each side, right? This is all oviduct where these eggs would be laid, right? Passed through the oviduct to be laid into the water, right? And what you see is the eggs kind of spilling out of the ovaries right here. So the eggs are kind of taking over the world here. So let's see if we remove the eggs. We're going to be able to see the rest. Really massive amounts of eggs. Okay, so most of this frog is taken up with reproductive organs, right? Somewhere in here we should be able to find the digestive tract, right? And here's the stomach right here. The stomach usually looks like kind of like a little J shape. I don't know if you guys can see this here. It's very muscular, very firm. Looks kind of like a little J here at the bottom. It curves around to join the duodenum, or the small intestine. So if we follow that, we should be able to see the intestine here, which is buried in all of these reproductive organs. And in all of the vertebrates that you guys are going to be studying, the pancreas, you remember the pancreas? What does the pancreas do?
Creates buffer and
Pancreatic juices, which is mostly important for digestion of fats, right? Lipase is one of the important enzymes. What else does the pancreas do? Insulin, glucagon, regulation of blood sugar, right? The pancreas is always in the same place in every vertebrate, and that is attached to the duodenum. So in this frog, it's this stuff right here. It doesn't look like much. But you see this kind of yellowish tissue that's attached to the duodenum. That's pancreatic tissue. You'll notice that it looks kind of lumpy and yellowish in most of the vertebrates. So just find the stomach, follow it around to the first turn of the intestine. You should find pancreas attached to the duodenum in every vertebrate, and it can be kind of hard to find. And then if we follow the intestine down here, so this is intestine 2. I'm trying to find you guys the spleen, which is very unusual in the frog. Usually the spleen is attached to the stomach. What's a spleen anyway? Any ideas?
It generates blood particles after they're old?
Yeah, it's kind of like storage and recycling of red blood cells. And in the frog, this is the spleen right here. It doesn't look like much either. It's a little red thing. It's always really dark in color. Do you see this red circle right here? It's totally floating in mesentery. You see what I'm holding up right there? See how it's not attached to anything except for the mesentery, that sort of epithelial tissue surrounding it? Most of the time the spleen's attached to the stomach, but in the frog it's completely isolated, just holding in place by the mesentery there. So let's see, we need to go further anterior to look at heart and lung.